Doctor. So, guys, today we are going to be joined by a specialist orthopedic surgeon. His name is Dr. Vibu Krishnan. He is a orthopedic surgeon at prestigious Devdas Hospital in Madurai. And the topic for today is demystifying back pain. Back pain has been causing a lot of issues to a lot of people, whether that is uh, older age group traditionally who have been facing a lot of problems in with regards to back pain, or it's housewives because of carrying a lot of weight, pregnant women, or these days also a lot of working class because they have been sitting a lot, whether this is IT people or people across different professions. So we will try to cover as much as possible about possible causes, symptoms, treatments, and what we can do to avoid and treat back pain. Dr. Vibu is going to help us understand what are the different methods that we can use and techniques and practices that we can do to avoid back pain. And there has been cases on the rise, which we have seen through our WhatsApp platform, that chronic back pain has seen a severe rise in the past couple of months. We see people across age groups, even surprisingly in the younger generation. A lot of cases arising because of back pain, and people have been asking us continuously a lot about products across different belts, abdominal belts, so many braces, creams, ointments, oils, massage oils about back pain. And we saw this potential category which has seen a lot of increase, unfortunately, in the case. Why? Because back pain should be dealt in a very uh, preventive method. First of all, there shouldn't be a back pain if we are keeping the postures right or probably having the right techniques, which Dr. Vibu will tell us. But at Cureka, you would find multiple solutions to your back pain issues. So you can browse through Cureka in the pain management categories, and you can check out different ointments in the wellness categories. The different oils, ointments available very easy for you that you can use to help you recover from a back pain issue. So Dr. Vibu is going to join us in just a while, and until he joins, let's try to understand what we have been doing at Cureka. So Cureka has been your go-to platform for all your healthcare needs. We are focused toward providing very high quality healthcare products and solutions that are handpicked by a team of expert doctors led by the very famous and talented Dr. Hema Satish, who is a dermatosurgeon, cosmetologist, dermatosurgeon, and she has completed her studies from the University of Wales, and Dr. Satish Devdas, who is an orthopedic surgeon, right? So their main objective is to provide high quality products and solutions to people across India. For that, we have a WhatsApp platform which is absolutely free of cost, no charge whatsoever. You can ask whatever question you want, and our care experts will come back to you, right? So Dr. Vibu is here, and we're going to start the session now with Dr. Vibu. Good morning, Dr. Vibu. How are you?
Good morning. Doing well. How are you doing? Nice to meet you all.
We're fine, and thank you so much for joining us today, Dr. Vibu. It's a pleasure to have you back on our channel to understand, what can we do to demystify back pain? What are the possible symptoms, causes, exercises, and treatments? So we have a lot of questions that have come. We are, I would say, bombarded by a number of questions for the past few weeks about back pain, which has been causing a lot of issues for not just the older segment, but surprisingly a very younger segment as well. So, doctor, what are the main causes of back pain?
Yeah, back pain is one of the commonest symptoms that we experience. The most common reason for having a back pain is muscular causes, as we call it generally. These are situations where due to our activities, the ligaments, the bones, muscles, there may be some sprains or strains in these soft tissues, which result in pain. So most of these situations, these are acute pain, by which we mean it happens in a in a short span, like over hours or over I mean just after a certain incident. And in most instances, 98% of these situations, they do settle down in a week or 10 days time. So that is the commonest reason for developing back pain. However, the reasons the other reasons which require greater care include what what we call as the degenerative spine. So by degenerative spine, the spine, as we go in, anatomically has number of bones, and there are discs or cushions in between these bones. So either these bones or the discs, they do undergo some changes with aging, and those do result in a pain. And these bones, apart from the discs, are also attached to each other by ligaments and other soft tissues. So they also undergo changes with aging. So they are put together as what we call as degenerative spine. Um,
Right.
in young people, disc prolapse is a very common cause. Of course, fractures, especially in osteoporotic spine in elderly, those are also well known causes of back pain. And another thing is that we should understand, whenever we have back pain, it's not always from the back. There are other reasons also which lead to back pain, which include hip problems. They can also lead to back pain. There are sometimes kidney stones, other urinary problems, and in women too, some other pelvic disorders, they can also lead to back pain. So these are the usual reasons why we have back pain.
Thank you so much for sharing that, doctor. So I'm sure people who are facing back pain are having back pain for one of these reasons. They fall into one of these categories. So typically, how can anyone stop back pain, doctor? What is the fastest way they can do, or what can they do to stop the back pain?
For once we have back pain, to get relief from it, the quickest way would be, first, if there is a trigger, like if some specific activities like bending, or sometimes certain sports, or even lifting things can lead to back pain. So first, avoidance of those activities is of utmost importance, so that we make sure that the same insult that's happening to the back is not repeatedly happening. So that's the foremost. And of course, apart from that, medicines, anti-inflammatory medications, those are the fastest relief from back pain.
Understood, doctor. So, doctor, what is the first symptom that anybody can see of a back pain?
Um, in most occasions, I mean, as I said, pain is pretty much the most. With any back pathology, pain is almost the first that is noticed by the patients. So, in terms of pain with relation to the back, there are two different categories of pain. One, the pain which is confined to the back, which is called as an axial pain. So that is, in most situations, that's the first thing that the patient experiences. But as the pain stays for a while, or the problem stays for a while, the pain starts moving towards other areas. So they are either called as referred pain or radiating pain, where the pain in the back, lower back, moves to the buttocks, or to the back of the legs, or even to the foot, as low down as foot. So that's a referred pain. So most common initial presentation with most of these problems is the axial back pain, or the pain pretty much in the back or at the sides of the spine.
Right, right. Understood, doctor. So, doctor, why does a person experience a back, hurting of the back almost every day? Now, this back pain is very recurrent. Why does a recurrent back pain come every day, almost to a lot of people?
Yeah. So as I said, other than the acute reasons that I initially mentioned, the ligament strain. Most of the back pains, they tend to have, I mean, they tend to be nagging over a period of time. The commonest reason to have recurrent or repeated pain episodes in the back are the degenerative pathologies, and of course, based on the age groups, we actually have. The reasons, the common reasons actually can vary. So, in a young child having a repeated pain, sometimes certain growth or developmental problems can be the reason, we call as spondylolisthesis or spondylolysis. Typically in a middle-aged patient, the commonest reason for repeated pain is something related to the disc pathology, which is either a disc prolapse or a disc herniation, and or this lysis or the lysis actually tends to happen even in the middle age group. In older patients, in their 50s or common or degenerative pathologies also include what is called as osteoporosis, by which we mean that there is a generalized weakening of the throughout the body, and backbones are the most commonly involved in this problem. So these are the usual.
Understood, doctor. So, typically, doctor, is walking good for in case somebody is experiencing back pain? Should he consider walking while having experiencing back pain?
Um, Regular walks are actually good ways to prevent back pains as preventive measure, for sure. So just like any cardiac exercise is good for the body as a whole, the back muscles do benefit significantly from regular walking and exercise activities. The core muscles, the strengthening of the core muscles and the hip muscles actually do significantly reduce our risk of developing back pain. But once we have back pain, definitely walking on level floor is a reasonable thing to continue. There is a problem with the back, which is called as lumbar canal stenosis, which is a degenerative problem. In this problem, it is something which happens with aging. Again, that there is a canal through which the spinal cord or the nerves pass. So with aging, the canal actually tends to narrow down. So when patient has lumbar canal stenosis, the typical presentation is the patient is comfortable at rest, but when he starts walking or beyond a certain distance, the pain starts to bother him significantly. So if walking for long distances worsens the back pain, then it is better to restrict. It's not necessary to be bedridden or not stop walking, but it is reasonable to restrict our walking distance to what is actually comfortable for the patient per se. So if walking does not really worsen the pain, then walking is a good exercise in general for the back.
Understood. Understood. So one should look out whether the pain is increasing or decreasing. If it is increasing, restricted. If it is decreasing, then keep on with it. Understood.
Yeah.
So, doctor, what foods are bad for back pain?
Um, I wouldn't say any food to be bad for back pain as such. The I would rather answer like what is preferred for a patient, which food is good for a patient with who is experiencing back pain in general. So
Okay.
in general, a common reason for back pain, as I said, beyond a certain age, is osteoporosis or osteopenia. And one of the things that actually worsens osteoporosis is additional deficiency of it's usually reasonable back health to be for to be on food which which is rich in calcium and vitamin D. Milk products are actually quite good with regard to the back. At least 2 glasses of milk is a reasonable thing to be on. The egg again, it's rich in protein, especially the white part of the egg. So that again leads to building up the muscles and the bones. Green leafy vegetables, those are again quite good with regard to the health of the back. One of the best things about our body is that vitamin D, which is extreme form of foremost our bone health, is produced by our own skin. So exposure of ourselves to the sunlight again is another way of enhancing the vitamin D production in the body. So even though you may be having food which is rich in calcium, as I just mentioned, unless our body produces sufficient quantities of vitamin D, the food that we consume, the calcium that we consume by the food is not reaching the bone, just gets excreted. Ensuring that we have reasonable exposure to sunlight, especially during the hours between 10 and 12 during the daytime. 10 and 2 in the daytime is again going to be pretty quite helpful for building the bones.
Right. Right. Thank you so much for sharing that, doctor. Doctor, in case somebody is experiencing back pain, then what is the correct sleeping position for them? What is the correct sleeping position for them when they are experiencing a back pain?
Yeah. Again, postures are extremely helpful. Being sitting postures, sleeping postures. As I mentioned, for walking, every body is different. So the foremost advice that is given is for the patient to see what suits oneself at the best. So in general, the guidelines are with back pain, going for a very soft or a springy mattress, or for a very hard mattress. Both are can be hard on the back. So something which is reasonably moderate is a good mattress. So choosing the right mattress is very important. In terms of the postures, with regard to the back, the both the nerves as well as the muscles around the back, they are quite relaxed when the knees are bent. Having a pillow or two once patients with back pain can significantly benefit from having a pillow or two beneath the knees, so that the knees are maybe around 15 to 20 degrees bent. Thereby, they that relaxes the concerned muscles and makes the patient feel more comfortable. Again, lying down on the sides with the knees bent, we call it the Ferguson position. Lying down on the sides with knees bent and having a pillow or two between the knees can be quite comfortable for the patients. The position that can actually worsen the pain sometimes is when you're lying down supine on your back with your knees fully stretched. So sometimes the patient, when they lie down for 11 to 12 hours during the whole night and then wake up, they can really feel much worse in terms of their back. So these are some of the general guidelines, but as such, the patient also would start knowing which position worsens the pain, and it's pretty reasonable to avoid such postures over time.
Right. Thank you for sharing that, doctor. Doctor, also, can gastritis cause back pain?
Typically, gastritis leads more to pain in the upper part of the belly, just or a chest pain. But sometimes, when there is a patient has been experiencing gastritis for a long time, the acid also tends to get reflexed back into the food pipe or the esophagus. So, in such situations, the patients may also experience pain in the upper back. That is again more so when the symptom would be much more when the patient is lying down, or when he wakes up, because that's when you're lying flat, the reflex is more as you don't need to, the reflex doesn't need to go beyond the against gravity. So it they do reflex is one reason why a patient with a stomach problem or a gastritis can have some back pain.
Right, right. Understood, doctor. So typically, doctor, at what age does back pain start for any person?
Uh, So our skeletal maturity in terms of the back is reached by around 15 to 20 years. So beyond that, beyond 20, 25 years, the degenerative changes in the spine start. So uh, as such, by degenerative change in the spine, we typically mean that the water content within the discs, which are the cushions, that is lost, and that is one of the earliest things that happens. So any patient having imaging or an MRI beyond 25, 30, you start seeing those changes. However, most commonly the pain or the symptom starts when we are around 35 or 40. That is the commonest age for a person to start developing back pain.
Right, right. Understood, doctor. So, doctor, what is the fastest way to cure a lower back pain, doctor?
In terms of the cure, as I said, avoiding the reason or the particular trigger which caused the pain is foremost importance. So some people may actually, driving two-wheelers or sitting for long hours in front of the system, as it's common in IT professionals, is a common reason for back pain. So such situations, avoiding the trigger, which means avoiding such long travels on the two wheeler, switching to alternate modalities of transport, or taking care of the posture in which the person sits in the office or during work hours. They can be quite, that may be the most effective way of getting rid of the back pain. But once the back pain starts, usually there is a need for some kind of an anti-inflammatory medication, at least in the initial 3 to 5 days, by which we mean there are a lot of non-steroidal anti-inflammatory med tablets, like Brufen, Overon, or there are which are the over-the-counter pain medication. So those can be helpful. If pain is reasonably less severe, paracetamol, 500 or 650 milligram paracetamol is a reasonable way to get rid of the initial pain. Um, so these medications are also available in the form of gels or topical applications today. So those are also good ways of getting relief from the pain. Hot water fermentation again can be quite helpful for the initial relief from acute pain.
Right, right. Thank you for sharing that, doctor. I'm sure that is quite helpful for a lot of people. Now, a lot of people are asking this question, doctor: how can they relax their back muscles? How can they
Um,
relax their back muscles?
Yeah, as I said, the most the muscles at the back, they are called the erector muscles. So those are they sort of contract when we bend backwards, and there are muscles of the core which are pretty much the abdominal muscles which contract when we bend forward. So the since the good posture is a good way to relax these back muscles. When we sit to have a good back support, make sure that you are not leaning too forward or leaning too backwards, because both the muscles do need to relax simultaneously for having a good back health. So having a good back support, sufficient cushions. The back support needs to extend up to the at the upper part of the neck, having an elbow support in the seat that we use over the day. So these are good ways to ensure that the back is reasonably relaxed. Lying down, as I said, the with the knees bent, or in the Ferguson position, by which we lie on the side with the knees bent and have pillows inserted between the knees. So those are again good ways to relax the back muscles. Regular back exercises again, they make sure that the muscles are well toned up, both the core and the back muscles. So it's not a shortcut, but to ensure that the back muscles stay relaxed during the rest of the day, regular back exercises, at least 5 to 10 minutes in the morning or the evening time, is the best way that the muscles stay relaxed over the rest of the day, and the back is protected for preventing back pain. So these are the ways that the muscles can be relaxed.
Understood, Doctor, sir. Thank you for sharing that. Doctor, a lot of listeners are asking a question, that can back pain be cured permanently?
um, Definitely, it depends on the reason for the back pain, the cause. So there are back pain is an inevitable side effect of aging. So as we continue to age, the back, just like any other joint, the knees, the hips, so the back muscles, back bones, the discs and the muscles, they do age. And just like a machine which has been, which is being used, which has been running for so many years, um, the joints of the machines do wear out. So our body, the back joints also tend to wear out over time. So the degenerative, these are collectively called as the degenerative reasons for back pain. So some degree of back pain can be inevitable with aging. But the back pain can definitely be controlled so that it doesn't become a everyday nuisance, or it doesn't affect the daily activities, irrespective of the age or the degree of degeneration. So there are, as I said, medications can help. Keeping regular back exercises can help. There are ways by which external therapy, like the interferential therapy, IFT as we call, or ultrasonic therapy. So those can help with curtailing the back pain. Or sometimes, some problems, they may require surgeries or injections as treatment. So based on the pathology, even though some degree of back pain can be inevitable with aging, back pain can be quite well cured if the correct treatment is administered at the right time.
Understood, doctor. So, doctor, what exercises can help lower the back pain?
So, as I just discussed, the back muscles include both the erectile muscles, which are behind the back, as well as the core muscles, which form part of the abdominal muscles. So, we do need to strengthen both the flexion exercises or the exercises which are done in bent postures. So, those are necessary, as well as the extension exercises, which are exercises to strengthen the muscles behind our spine. So both of them are necessary. Apart from that, strengthening of the core muscles and the muscles around the hip. So they are also equally important. So a combination of all these physiotherapy is necessary in a person, both to avoid pain of the back as well as to treat back pain.
Understood, doctor. So, doctor, does paracetamol provide some relief for the back pain?
It definitely does. Paracetamol is the safest analgesic. It is safe in terms of the short-term side effects, as well as it is safe with regard to the liver and the kidney. So it is definitely a reasonable first line analgesic treatment for back pain.
Okay. Okay. Thank you, doctor. Doctor, last question for the day. Does calcium help lower back pain?
Yeah. So as I said, it's calcium is an indirect reason for back pain. So osteoporosis, or weakness of the bones, is a common cause for back pain. As such, calcium, taking calcium as tablets every day may not really help, because the calcium that we consume may not really reach the bone. Um, so we do advise it regular taking regular doses of calcium every day is not going to prevent back pain. However, in patients with established osteoporosis, um, having calcium, regular dose of calcium, along with vitamin D and other medications for osteoporosis can be quite helpful in relieving the back pain.
Right, right. Thank you so much for sharing that, doctor. This has been a wonderful session, and thank you so much for your time. You have been traveling still. You took out the time to connect with us. We really appreciate it, and we really want to thank you. And
Thank,
thank you for from our audience as well to
thank,
help us understand more about how we can reduce the back pain. So, wish you a very, very happy weekend, doctor.
thank you very much. It was a pleasure meeting you all. Have a great
Thank
weekend.
you. Thank you.
Bye
Thank
bye.
you. So, guys, this was Dr. Vibu Krishnan enlightening us with what we can do to reduce back pain. So, as I shared with you earlier, we have got a number of solutions to help you reduce back pain and avoid back pain as well. Some solutions that Dr. Vibu told is taking care of your postures. IT people tend to sit for a long time, taking some breakout timings and doing some exercises, but also you can take some supplements which can help you. We have got a number of protein supplements, calcium supplements on Cureka.com that are recommended by doctor and that you can take to take care of your health and have a good and healthy life. Apart from that, there are some pain relief products, very high quality. We've got products from all the national and international brands, whether you call them different brands like Tynor, Visco, Flamingo, Nebula. We've got Aircast, Donjoy, multiple others, Dyna. So you can have a look at them, and based on the recommendations from your doctor, you can let us know what product you would like to buy. And if you do not know what product is best suitable for you, you can connect with our care experts via free of cost WhatsApp platform on Cureka, and our care experts will guide you what product is best suited for you. So with this, I would like to thank you for your time. This is your host for today, Rahul Nanuhal. Wishing you a very, very happy weekend, guys, and take care. Cheers and all the best.